back to Debunked. With the emergence of AI, technology is everywhere, including healthcare. Today we're going to learn how those fields intersect by meeting Dr. Owais Durrani, an emergency medicine physician from Texas.
He has worked with the federal government to improve healthcare in underserved communities. He is passionate about educating the public about healthcare literacy and is active in health journalism. He also hosts a show encouraging students to engage in STEM called STEM City. With such a broad background, I can't wait to hear about his journey to this point.
I'm very excited to understand how he got here and what drives him. So without further ado, let's have him join. Hi, everyone. Welcome back to the Debug Podcast. Today, we are interviewing Dr. Durrani, and here I have Tushar co-hosting me.
My name is Tushar. I'm from Northeast Philadelphia, and I've been part of the Debug team for the last 2.5 years now.
Thank you so much for joining us today, Dr. Durrani. Really excited to delve into your history and understand a little bit more about what you've done. Just to begin, you've spoken about being a first-generation American, growing up with your parents who immigrated from Pakistan. How did those early experiences shape your view of STEM, healthcare, and what's possible? And what lessons from your childhood do you still carry with you?
Yeah, absolutely. Thanks so much for having me. Excited to see what you all are doing and kind of having these conversations when it comes to STEM. So I just want to say congrats on everything y'all have done. But yeah, for me, as a kid, we would go back to Pakistan every summer to, meet up with my family and kind of see all our relatives and whatnot. And from an early age, I saw how lucky those of us that grew up in the US are when you see, the lack of a healthcare infrastructure in a lot of other countries like Pakistan, or the lack of access to care and whatnot. Now, I'm not saying things are perfect here, but when you compare the two, there is a huge difference, and there are many more resources and the ability to seek out care. And so early on, I saw that. And as I, kind of went through college and then med school residency, that always kind of stuck with me. And so it's really kind of informed how I go to the hospital, how I view my patients, how grateful I am for the opportunities I have personally. And so it kind of, I would say, is a lesson and a perspective that, impacts how I function in healthcare and STEM to this day. I'm very grateful for the opportunities I have personally, and I want to do the most that I can with those opportunities to help as many people as possible here. And that includes, obviously including expanding access to care, making sure that people know the resources that are available to them, making sure that, I do my part in hopefully inspiring some young folks to go into STEM and the wonderful opportunities that are available when it comes to STEM careers and health careers.
You also have roles as a medical analyst, TV host, speaker, doctor, author. So how do you balance communicating those complex thoughts and topics in a way that's accessible and more people can understand, but without oversimplifying it and losing those nuances?
Yeah, so I think the key is to be, and I've realized that as, I've done more of this, is to be good at communication. You have to really be good at, what you're trying to communicate, right? So in my case, it's medicine. You have to really, really be good at the medicine, really understand the deep concepts, which sounds kind of contrary, right? Because you're trying to simplify these things. So you're like, oh, maybe if you have an overview of things, you can just it'll be easier to simplify, but that couldn't be further from the truth. It's really about having that deep concept and then kind of finding what are the things that are most relevant to, in my case, a patient's health, a human's health, what is relevant to their day-to-day life, and creating a story and a narrative around that. And I think what happens a lot is, if you post something on social media or you go on the news, someone will ask you something, right? You post something, and it may be a question the news anchor is curious about, and it may not be a part of their script or whatnot. And if you don't really have a good grasp of the concept, then you're going to get exposed. You're going to get nervous. You may not have the right answer. Same thing with social media. You post something, the comment section, people might start asking you a whole bunch of questions when it regards to what you posted about. And so having a good firm grasp of what you want to communicate, whether it's medicine, health, other concepts in STEM, and then that makes it easy to make it into what you kind of alluded to, a simple story and a narrative that is relevant to people's lives. And that being said, it takes a lot of practice. I was really not great at it the first time I did it. And then each time I've done it after, whether it's on social media or whether it's on a news channel, it becomes easier and easier and easier. And you learn how to kind of distill those complex topics into things that are relevant to someone's everyday life. Yeah, that makes complete sense. As someone who has a good amount of experience in personalized medical tools for patients, I could definitely say that it's easier to make something successful when you definitely target at the patients if you're thinking in the medical field. and using AI as a tool is helpful to create such platforms. And I know we talked about using AI for scholarships, but you also mentioned using AI as a note-taking tool as well as for medical device training. So aside from that, what are some of the most exciting ways you've seen these tools help? And what are the pitfalls young people should be aware of as they enter STEM fields they're integrating AI into? Yeah, so I think, obviously turn on a news channel and the headline may be like, I know AI is going to take people's jobs, or there's going to be like no entry level jobs and whatnot. And it's kind of true. It's kind of not true. What's not true is AI is going to replace the people who ignore AI or who want to like not learn AI because they don't think it's relevant to them. It's not going to replace the doctor or engineer or chemist who can then who has embraced AI and can then use it to like make their research 10 times quicker, 10 times better. They can look at more options and whatnot. And so I would say, first of all, there's a lot of fear around it, and some of it, rightly so. But I think embracing it and then really connecting it to what your training is in will allow you to not be impacted by some of the negative things that we talk about. In terms of how I've seen it in healthcare and medicine, there's so many applications. You kind of alluded to one of the things, like as an emergency medicine physician, I do is have to, see patients, but then have to like document and create a note and whatnot. Made that process so much easier, right? Traditionally, like it takes hours for clinicians to write these notes and edit them and make sure they're factually accurate. Well, now there's like an app. I let the patient know I'm recording through this AI app, put it in my pocket. I come out of the room and the note's like 80 or 90% done. And so it's cut down on my time that I'm spending in front of a computer, and I can spend more time with patients. I can have, better teaching to them. I can sit down and answer all of their questions versus before it's like, okay, I got to get out of here and work on this note because I have to have all my notes done by the end of the shift. And so that's one example. AI is tackling a lot of things on the back end as well when it comes to, doing the pre-charting for like if you have like a cancer patient coming in and they have a very complex history, kind of narrowing down the high points, the reason for the visit and whatnot, automatically being presented to the doctor before they walk into that room, kind of cutting down on time when it comes to that. And then, of course, there's the kind of drug discovery side of things where I would say we probably still haven't had like, the big breakthrough or like the big cancer drug or whatever the case may be from AI, but I imagine it's only a matter of time that that happens at some point. But the fact that you can like simulate experiments and, use data and change it and be like, okay, if I got a different type of data, would that be helpful? Should I even get a different type of data? And being able to answer a lot of those questions in an efficient manner, I think is like obviously a game changer when it comes to how long research and clinical research traditionally has taken. One quick follow up on that. Do you think that in the next couple of years, certain AI tools could be implemented into clinics and hospitals? And if so, do you think that the jobs of certain clinicians or radiologists are at risk? Yeah, so the implementation, it's already happening, right? So there's certain tools that are helping radiologists read CT scans and x-rays quicker. It's triaging them for them, where if it like sees a emergent finding, it'll say, hey, there may be an emergent finding here. You should read this one first versus, if it's a number 40 down the list. And so there's various things like there's also like fall detection tools in rooms where if they see a patient maybe falling, it'll alert someone. They'll come in and make sure the patient doesn't fall out of bed or anything like that. So there's already tools that are being implemented in most hospitals. In terms of jobs being at risk, I think things will shift, right? So yeah, the perfect example is, like 30 years ago, cardiothoracic surgery was a very popular field, very competitive, because how you treated someone with coronary artery disease a lot of times was giving them like an open heart surgery, getting a CABG, and so they were in high demand. As the field of interventional cardiology has evolved and you can place stents and do various procedures that are minimally invasive, the cardiothoracic surgery positions have gone down, but more people now go into interventional cardiology and advanced fields like that, interventional radiology. And so I think it'll be the same thing. Like maybe less people will become general radiologists, but there will be other fields within medicine that will arise from this kind of AI shift that then more clinicians will go into.
Is also really increasing accessibility across the nation because rural hospitals are also able to increase what they're working on just based off of AI's help. So you're an advocate around health equity in underserved communities. So how can young people in STEM or medicine also begin to meaningfully engage in these issues and make a difference? And what should they be working on, or what mindset should they have to approach it?
Yeah, so I think like what you guys are doing here is perfect, right? You don't have to have the answers, but you want to be asking the questions and you want to know what's coming down the pipeline. What are the pros of it? What are the cons of it? What are they trying to address? And so I think just being a student and learning whatever STEM field you're going into, how is AI being implemented today? What are the things that people are trying to work on? How is it going to impact me? And then how can I be a part of it, right? And so maybe you're in college and there's like an AI company revolution, there's some type of petroleum engineering technology that you're kind of going into, maybe seeking an internship there, maybe, emailing someone from the company and saying, hey, can I like interview for a podcast, or can I shadow you for a few, like a spring break kind of thing. But just being around the innovation, asking questions about it.
Finally, most of our listeners are middle schoolers or high schoolers, and many of them are interested in getting into STEM, but oftentimes there can be barriers getting into it, or they're worried about if it's even for them, and it's a big step to actually commit to such a field. So do you have any advice to give them courage or perspective, or any tool that you think would be really valuable for any students that are interested in getting into STEM?
Yeah, finding ways to get that initial exposure, right? So if you think you want to go into medicine, like just shadowing a doctor for, a day or 2 days and seeing like, hey, is that interesting to me? If you're in college and you're like, hey, I'm torn between like chemical engineering and computer science, I'm not sure which one's for me. Like, it's okay to take a computer science class and a chemical engineering class, and you're going to like one and maybe you're not going to like the other. And that credit you took that maybe doesn't count towards your degree, say like you like comp sci and you want to head down that way, and you're like, well, this was a waste of a chemical engineering credit. Don't think of it that way. It's not a waste, especially when you're young, to like experiment and try with like a bunch of different topics and ideas and career path. No one's going to care.
Yeah, I see that all around me where people are very nervous to change their major, but it's like they just got here 2-3 weeks ago, maybe a year ago. It's okay to change, and things usually pan out at the end. So it's a really great point to make. Thank you so much for speaking with us today. It was a really insightful conversation.
Yeah, thank you so much for having me.
Hearing Dr. Durrani talk about his journey from medical school to the emergency room and now to the national stage as a voice for health education really shows how many paths there are within medicine and technology.
Absolutely. And the fact that he brings that same passion outside the hospital, using his background in health policy to address gaps in care for underserved communities, is just incredible. It really highlights how doctors can create change beyond the bedside.
His work in health journalism, explaining medical issues on national news, helps people actually understand what's happening to the world around them. That's huge, especially in a world where medicine seems to have so many layers and barriers to understand.
Talking with him today was such a reminder that the intersection of tech, healthcare, and public service is full of opportunities, and that anyone listening could be part of this space someday.
Thank you so much to Dr. Durrani for joining us and sharing his insights and experiences and energy with our audience.
And thank you for tuning in to this episode of Debugged. Before we wrap up completely, let's get back to our tech news.
Researchers built a new kind of computer that uses light instead of electricity to perform computations. Many experimental computing systems, especially those based on advanced physics, only work under extreme conditions. Some need to be cooled to under hundreds of degrees below zero because heat creates too much noise and instability. Others require tightly controlled environments just to stay functional. These systems can work, but they're difficult, expensive, and impractical to use widely. The researchers created a new type of computer that works at room temperature, meaning it can operate in normal conditions without special cooling or exotic equipment. That makes the technology far more realistic to build, test, and eventually use wide. To understand why this matters, we need to take a step back and talk about how computers work in the first place. Inside every computer, phones, laptops, and game consoles are billions of tiny switches called transistors. Each transistor can be in one or two states, on or off. By switching these on and off extremely quickly, computers store information and follow instructions. For decades, computers got faster mostly because engineers kept making these switches smaller. Smaller switches meant more of them could fit onto a single chip, which allowed computers to perform calculations at a faster speed. The long-running trend became known as Moore's Law, the idea that computing power would roughly double every couple of years. That's why computers from the early 2000s feel so slow today. But now, Moore's Law is slowing down. Modern transistors are so small, just a few atoms wide, that physics starts to intervene. Heat becomes a serious problem, energy efficiency drops, and electrons don't always behave at predictable ways in that scale. In simple terms, we're reaching the limit of how fast and small these switches can realistically get. So researchers started asking new questions. If we can't keep making computers faster by shrinking transistors, what else can we do? One answer is to build computers that work differently, instead of just trying to work faster. That's where light-based computing comes in. The system is designed to solve a specific kind of problem, problems where the challenge isn't calculation speed, but too many possible choices. For example, finding the most efficient route that visits many locations, scheduling tasks without conflicts, or choosing the best configuration of parts of a system. In these problems, the number of possible solutions grows incredibly fast as the problem gets bigger. A traditional computer often has to test probabilities one by one, which becomes unrealistic at large scales. The new system approaches this challenge with a physics idea called an Ising model. Instead of testing every option, the problem is converted into a system of simple choices, each one having two possible states, like on or off. These choices affect each other, and the goal is to find the arrangement that creates the lowest energy state. Rather than calculating it step by step with software, the researchers let physics itself find the answer. In the machine, information is stored in light pulses. The way those pulses interact represents how different choices influence one another. As the light moves through the system, it naturally settles into a stable pattern. That stable pattern corresponds to a good solution to the problem. This approach has three major advantages. First, it works at room temperature. Many experimental computing systems require extreme cooling to function. This one does not, which makes it far more practical. Second, it stays stable for hours. Earlier versions of similar systems could only run briefly. Long-term stability is essential for solving real problems. Third, it's energy efficient. Light produces far less heat than electricity moving through wires. As computer energy use becomes a growing issue worldwide, this is a major benefit. Another important detail is that researchers built the system using mostly standard optical components, not rare futuristic materials. That means other scientists can reproduce it, improve on it, and build. This kind of computer isn't meant to replace your laptop or phone. It won't run apps or games, but instead it represents a new direction for computing. As Moore's law slows down, breakthroughs like this suggest that the future of computing may be built not through faster switches, but instead with light.